Today the agenda for the Eggheads has a Baltimore trip. I know this sounds silly, coming to this campground and then rolling back to Baltimore, but if you think about it again, this trip has been booked a long time before we knew any of this was really happening. The visit in Baltimore is with John Hopkins Hospital for the second opinion, which is really important. We can't cancel it. There's nothing we can do but to drive there from here and then back to this campground to enjoy the rest of our stay. How are you feeling?
Good.
Well, you're looking incredible.
Thank you.
The road leading up to this campground is this crazy, twisty, bendy mountain road. Not for people with sensitive stomach. It's funny how this looks so normal in this video, and when you drive this, it's like serious roller coaster experience.
It looks normal. Look at this. You should show this GPS.
I see it, I got it. Is this it? This is
I think this is
where
it.
we're going?
It seems to be. Patient drop-off.
Okay, go in here.
Parking.
I'll
It says,
park.
it says parking. I just wanted to see what you're talking about, the treatment I'm getting so far, and if you would change anything, or in the future, if something changed, would you change anything? And
Right, okay. And you shaved your head just in
it started,
preparation?
well, actually, I had long hair, and I cut it really short, and
Mhm.
then just this week it started to come out in handfuls.
Right.
So just yesterday we did this, actually.
Oh, okay, all right, okay, and that looked pretty quick. You know, everybody thinks, well, modern medicine is just turning, not listening to what's going on, and these testimonies that you hear about people curing, those just aren't true. And you have to make the assumption that there are hidden areas of cancer sitting in your body someplace. So the goal is to kill all of these things. And realistically, can we, in this day and age, could we look you in the eye and say we're going to kill all these cancer cells? We can't do that. We don't have the right stuff at this point. And we've seen people go for many, many, many months, and sometimes many years, with no evidence of recurrent disease. Every oncologist that's seen any number of, seen a few breast cancer patients, has somebody in their practice that presented as you presented with distant disease, and they're still thrashing around, many, many years later. But that's, I'm being honest, that's not the average patient.
That second opinion visit at John Hopkins Hospital unfortunately did not reveal anything new to us. What does that tell me? It tells me exactly what I already knew. Traditional medicine does not have answers, or at best they have very few answers. It can be used as a complementary method to beating cancer, but if you rely solely on it, therefore, we're just gonna keep going, doing our own research, exploring different methods, and not letting ourselves get depressed by what the doctors say.
Always try to give. Don't ever take
the second opinion appointment?
I'm happy that we went because I'll have access to the trials if that time comes, but otherwise it kind of felt like a waste of time. But it wasn't a total waste because I do have access to that if the time comes.
Day 1 of being a no-hair woman.
Did you notice anybody staring at me weirdly?
Not at all.
Me either, really.
So, what does it feel like?
It feels bald. Doesn't it kind of look like I have a bald cap on, like it's fake?
It does. I feel like you're gonna go back inside the airstream and come out with your regular hair.
I feel like I could peel it off and the hair is packed in underneath.
So are you happy that you discovered to have a perfectly shaped head?
Do I have a perfectly shaped head?
I think so.
I can't see at 360 degrees, so I have to trust you.
Well, if you turn to the sides now, you can look at it in the video. It's perfect.
Okay. I'll trust you.
So are you shocked? Are you scared? Is this as depressing as most women think it would be?
I would never choose to be bald, but I'm not, like, dwelling in sadness about it. I'm not embarrassed to go out, if that's what would happen. I don't feel like I need to cover it up all the time. Because, like I said to you, I feel like I wish more women who had cancer were bald. Because then I feel like we would realize what a big problem it is. Right now, if you just cover it up, you think everybody living around us is normal and doing well and fine, and maybe people just don't realize how big of a problem it is. Because people look well, and meanwhile you don't know that they have stage 4 breast cancer.
And meanwhile, it is so good to simply discover another beautiful side of you.
You mean this side? Maybe I should get a tattoo on my head. No?
I don't think a tattoo is necessary.
No, I would get butterfly antennas. Because I already have the wings, so...
Will you take part in my life, my love? That is my dream.
Put the magic orange to the lens and we'll be at the camp.
We're home!
Magic!
It's magic!